Hi, I'm Cathy D. I've come to talk to you today about death and dying in the United States. Despite the amount of funding invested in hospice and palliative care services, there has been little progress made in how we take care of people in their final days. Major deficiencies in quality exist, including more time spent in intensive care units, ICUs, and delayed referral to hospice care, according to a 2014 report from the Institute of Medicine. This report and other findings were used in a study published in the Journal of Palliative Care, Teno, Freedman, Kasper, Gozalo, Lee, and Moore, 2015. Researchers reviewed survey responses from two separate groups of people, 622 participants in the year 2000 and 586 between 2011 and 2013. The study's primary goal was to compare the differences in responses between the two groups. Family members shared their observations about the care that their loved ones received during their final days. Comparing the responses between the cohorts, interviewed a little over a decade apart, respondents shared that hospice care at home was superior, that quality of care concerns increased in areas with higher rates of ICU care, and that frequent concerns of unmet needs were expressed by African American families. Teno et al., 2015. The second goal of the study was examining how patients experience end-of-life care. The study indicated that the number of patients experiencing moderate to severe pain in their final month increased over 20% from the first group surveyed in 2000 to the second group between 2011 and 2013. 11% of the respondents stated that treatment decisions were made that the patient would not have wanted, and that percentage doubled for patients who died in the ICU. Teno et al., 2015. Patient-centered care that is responsive to an individual patient's needs and is respectful of an individual patient's wishes, especially during one's final days, is mentioned in just about every provider's vision statement. But is it just rhetoric? Everything about an organization should support what's stated in its vision. Goetsch and Davis, 2016. Patient-centric, patient-focused, provider of compassionate treatment, and other buzzwords don't mean much to a patient being kept alive in the ICU. One of the key elements defining the total quality approach is customer focus. The customer is the driving force. Goetsch and Davis, 2016. Organizations who are customer focused prioritize customer satisfaction. Patients are customers of a healthcare organization, and ethically speaking, are customers regardless of what stage in their healthcare they are in. From birth to death, patient-centered care should be tantamount in healthcare organizations. Dr. B.J. Miller is a palliative care physician who works at the Zen Hospice Project in California. In a TED Talks presentation, he shares his personal skirt with death as a young man. He lost most of both legs and part of his left arm after being electrocuted during a juvenile prank. Sharing his personal hospital experiences, he describes the harsh, bright lights, carts crashing, the drone of beeping sounds. He says hospitals assault our senses. Miller, 2015. B.J. Miller returns to college, eventually studying medicine and becoming a physician specializing in palliative care. Palliative medicine is about providing comfort and about living well, according to Dr. Miller. Miller reminds us that hospitals are meant for treating illness and acute trauma. They aren't places to die in. Miller, 2015. People who face their end of life talk about their wishes for comfort, spirituality, and peace. It's important to feel human, to feel connected. Miller, 2015. Dr. Miller talks about the hospice's kitchen as a surprising component of care in a place where many of the residents can't eat most foods, if they can eat at all. But the kitchen staff bakes cookies regularly, and the scent of fresh-baked cookies is enjoyed by everyone. The Zen Hospice Project adds sensory richness and joy wherever possible. Living one's final days out in a hospital, somewhat anonymously, and alone much of the time, connected to tubes and noisy machines, is grim. It's painful for loved ones to witness. Dr. Miller describes how the Zen Hospice Project honors someone who has died. The person is wheeled through the lovely Zen garden to the awaiting hearse, surrounded by the staff who cared for him, by family and other loved ones, whomever he's chosen to be present in those final moments. Flower petals are sprinkled on the body. Death is ushered in with warmth and love. Quite a different experience at a hospital. The patient dies, and medical staff begin unplugging the various life support systems, some of the beeping sounds continuing even after the patient has died. Housekeeping enters the room to erase any trace of the person who has died there, as though he never lived, and to make room for the next guest. Dr. Miller reminds us that more people than ever are living with long-term illnesses. The baby boomers have created shifts in the population, impacting how and where people with terminal illness will live. He suggests that we must remove unnecessary suffering from the system. Miller, 2015. We should improve the quality of dying by tending to the patient's dignity by way of his senses. Quality care should include conversations with the patient and family through the end-of-life process. Healthcare should be about making life more wonderful, and that should include making the passage leaving this life more wonderful. One not-for-profit hospice in Niagara Falls, New York, started a campaign called How Will I Know? DeLuca, 2016. After seeing the trend of patients who came to hospice for help in only their last week or two of life, Niagara Hospice reached out to their community to inform families about when the right time to connect with hospice is. They advised, "Don't wait, ask us." DeLuca, 2016. Starting an earlier relationship with hospice, they say, will improve the patient's quality of life. Hospice can manage pain better and extend a patient's life. Niagara has volunteers that make up something they call their vigil team. These are the folks who sit by patients' bedsides, keeping vigil, patients who may not have any family or loved ones to stay with them in their final days. The program is funded by Medicaid and private insurance, since hospice care is far less expensive than warehousing patients in hospitals or trying to keep family members at home with no professional health care givers, precipitating frequent visits to the emergency room. DeLuca, 2016. Major deficiencies do still exist in the system in how we provide care to patients and family when dealing with end-of-the-life stage of an illness. I'd like to see the trend continue in places like Zen Hospice, honoring one's life with love and sensory stimulation, ushering one into peaceful final rest with one's family, loved ones, and caregivers with flower petals and soft music. Thank you.